All right. Good morning, everybody. I am Aaron Nelson with the Chamber for Greater Chapel Hill Carborough, and we have with us the Director of Environmental Health for Orange County, Victoria Hudson, as well as 80 members of our restaurant, retail, and hospitality community to have a conversation today on the economy in the time of COVID, specifically what to do if and when your employee tests positive or one of your vendors or potentially confirmation of close contact with a customer. So let me introduce Victoria. We'll do 20-30 minutes of presentation and then lots of time for Q&A. At 9 o'clock, we will stop the formal presentation, turn off the recording, but then we'll stay around for a while. If you have additional questions, we'll be happy to answer them then. Victoria, welcome.
Thank you so much for letting us have another meeting. We talked last week, if you were at that Zoom meeting or listened to the recording, about checking back in a couple of weeks and see how things were going. And circumstances over the long weekend made it where, I think we should check in a little bit earlier. And so I do appreciate the participation that has happened so far this morning. It was a little bit last minute for some of you. There's 86 people on this call, and I think that that's outstanding and demonstrates the capacity for us to really be able to group together. So this is all, works in our favor. One of the things that happened over the weekend is that we received a disproportionate amount of calls and inquiries about what to do about either sick employees that had tested positive for COVID-19, or sort of tangential contacts, those contacts, whether it was family members and things like that. And then there was this, I see that other places are disclosing it. Am I supposed to disclose it too? This has me very worried. I don't know if I want to open now to the public. And they were using that as the decision-making feature that was very concerning to me. So what I wanted to do was to put together a real brief presentation. All of these materials are, going to be available to you. It's not like we're going to have any official documents, but we can certainly, I made a few lists and a few sort of thinking algorithms so that you can use those in your own decision making. So the first thing I want to talk about, can I share my screen now?
Perfect.
So you can see my screen. All right. So the first thing I want to say is the email I sent out yesterday afternoon has this employee screening checklist as a spreadsheet. And the way I thought it would work is these are the exact questions as they are on the document that was provided by North Carolina Department of Health and Human Services. It's just a spreadsheet so that you can record 31 days in the month. So you would just type in an employee name, the month, the year. You can make, multiply these sheets and just have one for each employee. It would be very practical, and it would save paper, and it would be excellent documentation that you have done the screening. Is everybody good with that?
Remind everybody the requirement on the screening, please. You're
required to screen all of your employees. That includes the persons in charge as well, because sometimes that's sort of overlooked. Like, even if it is yourself, you yourself should have some documentation that you have screened yourself for the day if you are that person in charge. Sorry.
Victoria, we probably have some retailers and others. This is, you must do it if you are a restaurant. You must do it if you are a swimming pool operator. Who else must do it?
It is my understanding that those are the personal care must do it.
And how about hoteliers as well?
Well, we're going to talk a little bit about what a definition of a restaurant is in a little while, but yes, they should go ahead and get on board with this with all of their employees. And I think this is here to stay for some period of time. I don't think that this is going to be something that's just like, oh, until we get to phase 3. I think that everybody needs to become accustomed to this sort of check-in, and it must be done before someone starts their shift. And of the calls over the weekend, there were 2 of the calls about employees having symptoms that would have been caught and kept them from working if they had done the screening, but both of these instances happened before the screening was required. So that said, I think it's a good tool. And we're going to have this for you probably in the next week. I had to work with Language Services, who's been very helpful, and they're going to get it in the Burmese and the Karen, and DHHS did have it already in Spanish. I just need to double check that when I dragged it all over to the spreadsheet that I didn't change any of the meaning or content. So, the other thing is that do you understand about what happens when people have symptoms? So let's say you have an employee that has symptoms. If they have the symptoms, and if you need a list of symptoms, they're on the website. Oh Lord, what does it say? This is from various sources. This is the North Carolina DHHS. You can get it by Googling DHHS symptoms. You can get it from going to the Orange County COVID page. Fever, cough was the first ones we always heard about. Fever, cough, shortness of breath was something that happened, seemed like a little bit later. Then they added chills to the fever, and then they added repeated shaking with the chills, and then they added muscle pain and headache and sore throat, and now it's also new loss of taste or smell. So these are the symptoms, if you aren't aware, these are the symptoms that you have to be screening for. An employee who has symptoms must be excluded from work. So if you have an employee that has those symptoms, they must be excluded from work. And getting tested is one of the quick ways to go ahead and take care of this situation. And testing is available, and there are on the COVID page for the health department, there are sites where people can get tested. The first way somebody can get tested is getting a referral through their primary care physician. If they don't have a primary care physician, there are now pharmacies that are doing testing. But if the person is excluded from work and goes to get tested, the test results can come back. It should be about a day. The 3 that I have known about personally all came back within an 24-hour period. One of the ones over the weekend, the test was done on like the Thursday afternoon before Memorial Day, and then the result really wasn't talked about until Memorial Day. So I don't know that it took that long for the test result, but that was one of the ones that was done at a pharmacy. The test result is positive. The employee can return to work for 14 days after their first symptom if they have no more symptoms. So a lot of people who have a mild case, it might go away in a couple of days. They have a mild case and you wouldn't know it anymore, 14 days from the first symptom. Some people are getting tested, obviously, because they've been in case contact and they have no symptoms. So it has to do with the 14 days after you really first are notified. So you can return to work, let the employee return to work 14 days after the first symptom if they have no more symptoms. If the test is negative, they can return to work 24 hours after the last symptom. So maybe they were sick with something else, right? Maybe they had a little cold, or maybe they're having some weird sinus thing, but they can return to work. They get a test, the test is negative, they're returning to work a day after their symptoms stop. That's usual, that's reasonable and customary, the 24 hours after the last symptom. Now, a contact case are the people who are known and identified as having been in contact with someone who tests positive if they've been within that 6 feet and if they've been there for longer than 10 minutes. These are typically people in the household, and these are people that we're working with, because those are the people that we're with longer than 10 minutes. Those little contacts that happen in passing, at a store, something that doesn't take very long, they may not be identified as contacts, but the people who are identified as contacts are within that 6 feet, or they've been there longer than 10 minutes. So the thing about a contact is, contacts are identified at the interview level once the person tests positive. They are interviewed by the communicable disease staff in the county of their home. So the health department from their home county is the one who does this interviewing. And it is up to that person to answer honestly where they have been. And they're going to look at about that 48 hours before the first symptom. And they're going to call that the infectious period. And so they're going to want to know everyone that they have been within 6 feet of and longer than 10 minutes. Employees with contact that are identified as having contact with the sick employee or a sick vendor or a sick contractor or a sick supplier have to be excluded. They should be excluded in one of two ways. They can either go home for 14 days and self-isolate and see if anything happens, or they can go get tested.
Can you be clear on what you mean by excluded?
Excluded means they have to leave your establishment.
Got it.
They got to go home. So, are there any questions about this matter?
Let's pause here for a second. There's some things typed in the chat. I'm going to hit those first. One question was if they are just exhibiting one of those symptoms, a headache, for example, do they have to go home?
You know, I think that a headache is something that comes from many different things. If somebody tries to treat themselves for a headache, it doesn't go away. Yeah, they need to go home. So
you tried to treat your headache, it does not go away, you should go home. But if your normal headache remedies work for you, then maybe this isn't your problem. But multiple symptoms, now some of these, fever with chills, maybe they need to go home no matter what.
Absolutely. I think that this list is so comprehensive right now that a lot of those things could be something else anyhow. But the headache is something that, you know, a lot of people have a headache, and you know, if you got a headache, you go take your ibuprofen, and it just doesn't go away. And then with or without a second symptom, that's when you should probably contact a physician or think about going to one of the pharmacies for a test.
Then there was a question about where to go get these tests. There was a response which said that you can go to a CDC site which will show locations. Do you have advice about where to find testing?
That's exactly where I would tell you to go find testing. On that site, that's one of those sites that is all inclusive, and they are keeping up with it in real-time data, and they know when those people are out of test and things like that. So if you're looking right now for a test in your area, that is where I would tell you to go.
And my understanding is a physician or a provider must order this test.
Unless you go to one of these pharmacies.
But they will have, I believe, a provider on site, like in a Minute Clinic, that will order the test. Somebody who has prescription writing authority, I believe, is required to order a test to be tested.
That sounds correct, yes.
For some of you, tests are available for purchase. You can either from LabCorp or Mako purchase these tests and actually own them, but they will not get tested until somebody writes a prescription for it. So our recommendation is still to go to a physician or to one of the other places on this list and get tests. Piedmont Health in downtown Carborough and at their facilities also have tests, some of them in drive-up capacity. So if this happens, you also can call the health department or check that website, right, and find more information. Let me see a couple other questions before we move on. Does a caterer with no restaurant, just facility for staff required to screen?
Yes.
The answer, if you do get an answer also from A. Sowers, that is coming with the authority of the health, environmental health, correct? She's on your team?
Yes.
Let's see, employee, test, find a site. Sorry guys, just checking a couple other things. There are people dropping links in those. What is the cost of the test? Does anybody have information on that? I understand it to be free if it is written for you, if you are, well, I'll ask you, Vicki, do you know the answer to that question?
I don't have I know that originally just with us, any employee who had to go get tested, they just filed it on their insurance. And if they didn't have insurance, it would be handled like somebody who doesn't have insurance.
Blue Cross Blue Shield has said that they will cover these costs. Any COVID-related expenses will come with no copay. And so we should expect that test to be free. I do not know what it costs. I know to purchase a test is $70, but for an uninsured person, let's see if we can find that out before the end of this meeting and answer that question. If an employee had COVID previously and has recovered, but is exhibiting one of the symptoms now, should we send them home or should we make assumptions of some immunity?
We should send them home.
So this is no matter what. If this choice chart, if they have these symptoms, they are to go home. They can go then follow your choice chart, which is they go get tested again. If it comes back negative, they can return to you.
Yes.
If it comes back positive, it means they probably never really recovered from it.
There's an awful lot of chitter chatter out there regarding about when you get tested and whether or not it's accurate and things like that. And I don't have any expertise in that matter. I just know that we just have to go on what we're told, positives and negatives.
And the information we are reading and health departments and others are sharing is it does take a little bit of time from your infected time to when you are showing positive for the test. But somebody with symptoms would be showing properly positive. If you bump into someone at a grocery store and then go get tested tomorrow, it could be that you would be negative. Does that make sense? That's the case for many diseases, right?
Yes.
All right. I think I've covered. Let's talk about screening of vendors. I think you're going to get to that in just a minute. So let's move on from this section and take us forward, Victoria.
Okay.
Thank you.
So what I have here is, as people were contacting me over the weekend, it came together what would be kind of a to-do list. And the to-do list would be, you're going to continue to screen employees. And you're going to also screen vendors, contractors, and visitors to your kitchen. That means that the rug guy, the rag guy, the milk guy, everyone, the Ecolab guy, they all have to be screened. I think this is for your own protection, and a recordation of those screenings is super important to knowing a little bit about who was in contact with whom. One of the distress calls over the weekend was about a vendor who had been, who had brought product into establishment and put the product up and then made haste and left. And this vendor had symptoms. And I don't know how y'all feel about that, but why was that vendor having symptoms in your kitchen? So I think that it's important that you at least take the second and stop, or put the sign on your back door, or do something in some way that makes them take pause and take inventory. Some of you have large vendors, you know, like a Cisco and things like that. Ask them, ask the people that you're spending money with, what are they doing to screen their employees? A lot of you use tiny vendors, and it's real easy for you to have that kind of contact, but with the bigger vendors, you really need to know who's in your kitchen. It's usually the same delivery guy. Ask him what he is being, you know, what's happening with his employer. When you are notified by an employee of a confirmed COVID positive or contact case, the best thing you can do is determine the exact time that that person was last in your establishment. And so some of these calls come in, says, you know, I had a sick employee. He hasn't been here since, you know, the middle of May, and it's already the end of May. And I say, okay, where has he been this whole time? Well, he's still sick. He hasn't been back. Well, you know what you're doing in practice is exactly what we would tell you to do in theory. You're not letting a sick employee work. And then they got tested during this period of time they were out of work. It is positive, and they're going to follow the advice of their medical professional about how to work their way through getting healthy and then being okay to come back to work. So you don't have to worry about that. But knowing the time in which they were last in your establishment is super important. Were they and was everyone else wearing a face covering? If you can affirmatively say that they're wearing a face covering and they're wearing it correctly over their nose and their mouth, then you have that to say, yes, my people and everyone who comes in here wears a face covering properly. Did they wash their hands according to policy? Absolutely. You know that they wash their hands first according to the food code and then extra because of any COVID protections. How long were they last in your establishment during that infectious period? So what the interviewers of these sick people by the communicable disease staff, again, they're going to work with them to establish when was that infectious period. And what I'm again hearing is about 48 hours before their first symptom. So if they got sick on May 15th, and they'll go back to about May 13th. Were you working between May 13th and May 15th? Yes, I worked 16 hours during those time periods. You should know how long people were there during their infectious period. And you should know which employees that they had contact with. You already have attendance records. You already have, time sheets and the ways that you keep up with the hours that they work. Make sure you have those up to date so that you don't have to kind of backtrack, and it would be a very easy way for you to track when employees were in the establishment. How many documented cleaning disinfections have occurred since the employee was in your establishment? Now this seems like a dumb thing to ask, because surely, goodness and mercy, you go to the end of your workday and you break everything down and you clean everything up, and then you're disinfecting on the way out, and you know for certain that between May 15th and today that you have cleaned the establishment, 10 times. Well, have some sort of document that shows, even if it's just a check sheet, that the disinfection occurs at certain time and who maybe the responsible party is. The documentation is super key in this, because there are a couple of establishments that don't break down and clean up at the end of the workday. And let me give you a great example of that. The Sheets in Morrisville, heard on the news just yesterday. They're a 24-hour establishment. They can't record when they've shut down to clean and disinfect. So guess what they're doing today? They're shut down for 24 hours for cleaning and disinfection. If you already have that documented, then you don't have to worry about it. If you don't have it documented, you should probably be prepared to be closed for 24 hours for cleaning and disinfection. And then, is there any chance that you have any food supplies or food products that were handled by the sick employee, the sick contractor, the sick supplier, the sick vendor, that need to be put to the side and discarded? And sometimes there might be something. For the most part, everyone in this crowd works on a fresh only kind of basis. They have small amounts of refrigeration. They work very, very quickly. They don't have a lot of product that lasts for days and days and days. But if there is any chance that there's any kind of food product or supply that needs to be segregated and discarded, go ahead and think about that. The confirmed COVID positive person will be interviewed and referred for contact tracing by their home county's health department. Anyone who may be identified as a contact case during the interview will be contacted by the health department. So as their employer, and the health department will contact you probably first and say, hey, this person, he has COVID. I need some contact information on the following employees that have been identified as being in contact with this sick person during their infectious period. It is okay if you give them that information to the health department. And those employees, without divulging a whole lot of medical information about the COVID positive person, you should let them know ahead of time. The health department is going to contact you, and it is okay. Nobody is in any kind of trouble. There's nobody punitive. This has nothing to do with immigration status. Nobody is going to jail. This does not mean that other people are going to get sick. It is okay. It is very important to get them to answer the questions honestly with the health department if they were in contact with the sick person. Plus, they have to answer the phone. And if they get a phone call from some unknown number, or they get a phone call and somebody leaves a message, it's from the health department, the contact tracers are completely confidential. It is okay. They need to answer the phone. If you need any assistance with language services to talk to your employees, give me an email and let me know. That way we can get this information to them and that they feel better about it. This is the medical information of that employee. You are not required nor encouraged to make a public announcement. So I'm going to show you this. This is an excerpt from a blog by Jill Moore, who is an attorney who works for the UNC School of Government. She had a list of some items that the blog post was really about, how much of this medical information is confidential and that sort of stuff during the COVID thing. I thought that these bullet points were super poignant for what you need as an employer. The employer should immediately send the infected employee home and determine whether other employees should be sent home as well, especially any that have had close contact with an infected employee. When notifying the employees who are believed to be close contacts that they are being sent home, the employer may tell them that the health department is being contacted and a possible communicable disease in the workplace, and they will receive further information as promptly as possible. In addition to assuring employees who have been sent home that they will be kept informed, the employer should tell the employees that North Carolina imposes strict confidentiality on information about communicable diseases and encourages them to refrain from discussing or speculating about who may be infected or exposed. The employer should work with the health department to identify potentially exposed employees who may require follow-up. If the health department tells the employer that an employee must comply with communicable disease control measures, such as staying away from work for a period of time, the employer must require the employee to comply with the health department's instructions. Be aware that the health department may also instruct an employer to take other communicable disease control measures. For example, in some cases, it may be necessary to temporarily close part or all of a facility for disinfection. The employer may wish to seek the health department's advice on additional matters. So I think that pretty much says it. One of the things that I think that happened in other situations where it became some sort of like a bad media thing is it's because other employees talked. And I highly recommend some sort of confidentiality agreement when it comes to these matters, because it is the medical information of that sick employee.
And I would recommend you have that conversation now. Having that conversation in crisis when they're worried about themselves and their family and whatever, people can't listen very well. I'd have that employee conversation of if and when this happens, we are going to make agreements with each other about confidentiality, even so far as to ask them to sign, as Victoria said, a confidentiality agreement. Now, you should seek the advice of your own counsel. What we also don't want is the employee to say, I swore secrecy, I knew we had an outbreak, and I was told I couldn't tell anybody, because that also will destroy credibility. That's not what we are suggesting. We're reminding you, Victoria, is of the legal obligations to keep it confidential and to invite you to have that pre-conversation with your staff now.
So that's the gist of what I think that that covers, like sort of the to-do list of the documentation that you have. Just put it together. And then, because those are the questions that the health department and the contact tracers are going to ask. And this here is your legal information that will also help you maintain trust with all of your employees. Because if you're all in it together, then you're all in it together. And so I'm going to move on to what was the Orange County addition to the Governor's Order 141.
Let me ask first, with those two documents you shared with us, have those been made available to folks? Can we attach?
Not yet. I'm gonna just package them together. I'm gonna staple all these PDFs together and email them out or put them on our site.
Perfect. Thank you.
Okay. The Orange County order that became effective Friday at 5 p.m. requires restaurant, personal care, grooming, tattoo, retail employees, and staff to wear a face covering while on duty. Well, personal care, grooming, and tattoo already had that as part of the Executive Order 141. So I want to just emphasize here requiring restaurant and retail employees and staff to wear face covering while on duty. Here are some exceptions as well where the requirement does not apply. Recommending also that all businesses require customers to wear face covering while inside the business. So there's a lot of questions that come out. Do I have to make them? And what happens if they don't? And that sort of stuff. if you are a business owner and you say, I need you to wear a face mask when you come into my establishment, and they come into your establishment, is my understanding that they are trespassing if they are not wearing a face mask. You can trespass them just like you would any other customer that you need to have removed from your business. I am not any kind of expert on public relations. I do know this, that people generally do what they're told. You have good signage and you have good communication and you have some option for them when they want to come in. I know it's like that guy who comes to the country club and he didn't have his tie on and they won't let him in, and they give him a tie from behind the counter. That might be the kind of way I would handle it. And then there is a requirement that tables at restaurant are limited to no more than 6, regardless of what the state says about 10. However, more than 6 people may sit together at the same table if they are members of the same household. I am not sure how you're going to find out about that. I don't know if you're going to take a census and you're going to say who lives together. I know that you all would be very surprised to know that there are 7 adults living in my home right now. And so if we roll up into your restaurant and all 7 of us are in there, I assure you, you want to see my water bill? I assure you. There are 7 adults living in this house. So that said, I'm not real sure, but does everybody kind of understand that you are required to have face coverings on? There's no option. Everybody, even when it's 110 degrees in your restaurant. Okay. All right. The other thing that came out Tuesday, and I added it to the email yesterday, was there was a change in the way that the governor's orders, which were just abatement orders before, are now called an order of abatement of an imminent hazard. Here's a lot of whereas, a lot of proclamation stuff right here, whereas. Let's get to the pudding. Here's the good part. Restaurants are defined as those ones we call restaurants, permitted food establishments, other establishments that both prepare and serve food. This would include those places like yogurt shops, ice cream shops, coffee shops that don't have a permit because they're just, NCDA places. This also includes, but not limited to, restaurants, cafeterias, food halls, dining halls, food courts, and food kiosks. This includes not only freestanding locations, but locations within other businesses or facilities. If you're a hotel that just has continental breakfast, this means you. If you're a hotel with a restaurant, this means you. So there you go. And look at this one, private or members only clubs. So that includes country clubs. And when like our bars are able to be open, and the Moose Lodge and the Exchange Club and the Rotary and all that stuff, wherever you have those kinds of clubs, also have to wear a face covering. All right. And then
they must wear a face covering and follow all the other restaurant rules, correct? I mean, for this purpose. Like
for this purpose, yeah. The emergency maximum capacity, having the signage up, 6 feet, all that. Yes, absolutely. All right. Section 5 of this document has a new wording for enforcement. Pursuant to General Statute 138(18) and 25, failure to comply with the imminent hazard abatement order may result in injunctive relief or prosecution for a misdemeanor offense. Law enforcement is still the people who will do the enforcement. But in addition to just coming up and saying, hey, break this up, no, you've got to go, and no, you've got to put on face masks, they may also hand you some documents that are invitations to court. And nobody likes that. So I pulled this out of a Jill Moore presentation just to let you know. An injunction, if you don't know what that is a court order that tells a person to stop doing something. It could be a temporary restraining order, which comes sort of emergency-like and puts a stop on everything for about 10 days. A preliminary injunction could be something that's like that, but lasts a little bit longer, or a permanent injunction, which shuts you down forever. Also with an injunction, you could see a couple of other things, but when a person violates a North Carolina Public Health Statute rule or a local Board of Health rule. This is when the health director can create a procedural thing that will lead to the injunction. The thing that is going to lead the health director to make a decision like that is a history of noncompliance. And so what's going to happen now with some of the complaints that have been going into 911 and different police agencies and things, they may start coming to the health department. And like I said, we're making a written record every time there is some sort of request for service that turns out to be substantiated, and a history of noncompliance could result in you having an injunction by the Orange County Health Director. So the types of orders would be a temporary restraining order, a preliminary injunction, a permanent injunction. Failure to comply with any of these orders could result in a violator being held in contempt of court, and fines. Fines. There's usually a lot of financial problems with that. The other thing is a misdemeanor offense. It's a class 3 misdemeanor. A class 1 misdemeanor. There are criminal charges for violating public health laws. I don't know if you've ever heard of like weird stories, like where somebody knew that they had TB and they were going around and they wouldn't stay at home like the health department told them to. Occasionally this can happen. This misdemeanor offense is also what happens when people try to sell food without a permit, like they're cooking out of their house, or they're doing something that's kind of on the street or whatever, and they didn't have a permit. And this is where it ends up. This goes through the magistrate's office, and it will take up a lot of time and your money trying to defend yourself from that. So does everybody kind of understand where civil penalties are going now? And stop the share. And that's it.
That is incredibly helpful, direct, clear, specific, unambiguous, helpful. I really appreciate your time, Victoria. I know Victoria sends you all lots of reading materials. We are grateful that she makes herself available. For me, it's easier to understand when I hear it explained and said, and when we can have some Q&A. All of that stuff at the end about how they're going to enforce it, just in case you were thinking of setting up a food truck at the Alamance Raceway, I would discourage it. I think there'll be some additional enforcement going on over there. All right. There was a question about, should we test vendors? Test is not the right word. Screen is your questionnaire. Must do every employee every day on shift. You said before they go in your kitchen. Did you mean that, or before they enter your premises? Do you want premises? So before they step inside, they need to do that. Your recommendation is that they do that screening, correct?
Yes.
They are required to do it for all their employees, and you are strongly recommending they do it for all of their vendors.
Yes.
We are trying.
And to Wendy and Angela and Roberto and Cheryl and Moira and myself, anyone who's coming into your establishment and sort of breaks that, like I'm coming on in kind of thing, you're gonna have an opportunity to have that conversation. It's just like 3 basic questions.
Well, it may give you all some delight to screen the health department officials to make them take this test before they enter your facility. So I look forward to hearing on how those go. There was a question about other employers that aren't in this set. So the question was to schools that came through this group, but would you advise offices, retailers, schools, daycares to be screening their employees in a similar way before they enter?
Absolutely. Absolutely. And like I said, my experience came really from this weekend, having to field some phone calls, some panicked and concerned and really just people kind of feeling at their wits' end about things, like having to make these decisions about whether or not they should even be open. And just taking what I got from having those conversations and realizing that if this screening tool had been in use, that we could have eliminated some of that. So here's, a vendor coming through, anyone's door and is going to be there for a few minutes unpacking a truck. Well, it doesn't matter what kind of retail you are or whatever. You have somebody here who's unpacking a truck and could have asked the question, are you feeling okay? yeah, I'm feeling all right, but I've got this, I've been a little bit feverish, but my boss says I have to work. You have the right to refuse, right? You have the right to refuse any receipt. And so it would have been very helpful for some people to be able to know. The scary part, I think, is that sometimes the person in charge is not there when things are brought in. And then maybe there's just like some morning staff person who's in charge of like startup or something. That person also needs to be really empowered to do the screening as well.
That is helpful. What I will share with you, I was on a call with infectious disease experts at UNC hospitals, at UNC, sorry. Their advice is, so yes, you must do this when they arrive. I would tell your employees that this is what they will be asked. And if any of the answers are yes, to not come in and have you screen them. They should know this is what you're going to ask them. If any of them are going to be yes, don't even come to my front door for me to have to ask you. Once they've made it to your business, you've lost a little bit already. They're standing there and you're screening them. So if they know this is coming, don't come in. If they come in and you ask them these questions and they're positive, you're going to send them home. But why have that human interaction with them to send them home if you don't need to? Let's see, there is an answer to the question of what it costs to be tested. We'll try to find more information about that. It appears that it varies, that insurance is covering this test. An uninsured person may be able to get this test from Piedmont Health or from the health department for free. It could be that there's other ways to get this test that may have a charge. I'm sorry, I don't have more information on that. Victoria will be sending these documents out to everybody. That question was asked. What are the requirements for customers to sit down regarding wearing a face mask? So, Victoria, as I understand, there is no requirement for the customer to wear a face mask. However, you may require a customer to wear a face mask. It is your property, your establishment. You can set the rules about that, and you can make your decision. I've seen some folks that once they sit at the table, they unmask, but if they're going to go to the bathroom, they should mask. Victoria, do you have advice?
Well, what I was looking at is what the Commonwealth of Virginia is doing regarding their governor's order that anyone in an indoor public space has to be masked. And so parts of that do say that if you are dining and once you have been sat at the table, you may remove your mask while dining. And then once you get up to leave or go to the bathroom or do anything outside of that space, the 6-foot space, little bubble around your table, you should wear the mask.
Awesome. Brendan asked such a good question that other people are asking that we ask it. And I'm going to actually unmute. Brendan, if you're still here, this is Brendan Cox. Will you ask your question? Go ahead.
This is actually Leslie. Sorry, Brenda and I are here together. I remember reading in an earlier interim, in an email I thought that came from the health department that said if all employees were wearing masks at all times during their shift and an employee tests positive, that then only the employee that tests positive must be excluded from work. But did I read that incorrectly? I know earlier you were saying that if there's been contact, then all people who've been in close contact during the shift would need to be excluded. Is that the case even if everyone has been wearing masks?
It is I don't know the document that you're talking about, but I would say that I would leave it up to the communicable disease staff to answer that question, because you would have to have all kinds of assurances that the masks were worn and that there was no, infringement of the 6 feet and that kind of thing. And I think that the close personal contact that they're looking for is the ones where people had to be within 6 feet of each other. So those are the ones that they're going to ask about the most.
No, everybody working in it. So close contact 6 feet is literally everyone who works in a restaurant.
For more than 10 minutes, close contact, yes. Although, Brendan, it seemed to be the case that if a customer did have it and people just passed them by, that would not be a problem. But yes, for your kitchen staff, if they were all standing next to each other. But Victoria, you were real clear that you were like, so long as everybody's washing their hands, wearing their masks, cleaning it up, if you can prove all of those things, and Sally is COVID positive, Sally got sent home. but it could be that everybody else is good and that they continue to operate, right? They're going to talk to everybody, but they're not going to shut. Do you think they shut the place down just because Sally was COVID
Well,
positive?
okay, so I'm not a business person, but this is what I know. A lot of your kitchens are super small, and you don't have a lot of staff to begin with. And so there are other strategies that sort of need to be sort of thought about, whether or not you have cohort employees, like A, B, and C work together on these shifts, and D, E, F work on these shifts. And that way you have a way of separating out who was in contact with whom. And so I think that there's a very good chance that people won't get sick and the tests will be negative. But are you willing to keep those people sick and working, even if they were wearing masks?
So if Sally is positive, everybody who Sally was hanging out with will go get tested. If they are negative, they come back to work. If they are positive, they must stay home. And if they are negative, they come back to work, and Brendan just keeps going like he was going. Is that accurate?
That's correct.
Brendan, is that satisfactory answer to your question? And I'm sorry, I don't know who's sitting next to you.
Yes, it is a satisfactory answer. Thank you.
Let me scroll through. Sorry, I got to get really close to the screen because the words are small. You also can unmute yourself and ask a question while
Aaron, I've seen a question.
Go ahead, Vanessa. Thank you.
I think it was Judith asked that if we're posting job postings, should we say that we're screening and doing checklist in the job posting?
So let me restate the question to you. So if you're doing job postings, you say one of the conditions of working here will be that we screen you every single day. Yes, you could say that. I am not clear on whether you can exclude somebody from being hired because they have a temperature and a headache. That could just mean they're pregnant, that they have a temperature and a headache. Or it could be that they are a person with lupus, which gives them a temperature and a headache. And the non-discrimination on hiring people is maybe different than what we're talking about here. So I don't know, Victoria, do you have a thought, or anybody on here? Maybe.
Well, okay, so let's just use the same logic behind an employee health policy, which is what all of these establishments are required to have to begin with regarding foodborne illness. So do you already advertise that we're going to ask you these questions and screen you almost like this? We don't write it all down daily, but we screen for the same things that were part of the employee health policy. You wouldn't normally just put that in your job announcement. And people who work in food service, and you're looking probably to find experienced people, would know that this is the kind of thing that's going to go on. So I don't necessarily think that it's necessary, but I think it's a good advertisement.
So there seems to be comfort with you saying one of the conditions of your employment is that we will daily inquire as to your health. But I think you should be careful about saying that we are going to pre-test you before hiring you. That I just don't, there's been lots of legal questions about excluding somebody because they have a communicable disease or an infectious disease from employment, right? We can remember the 1980s and 90s on HIV. There's been other communicable diseases for which you cannot exclude employment. But I do think that once they are employed by you, you may screen them properly. I am not an attorney. You should seek some legal advice. I'm not exactly sure that that's what you were asking. We can see if we can find you better information on that question. But certainly let them know that as a condition of employment, they will be working in food service and being screened daily. Let's see. Vanessa, did you see another question? And then I'm going to read one. Folks also welcome to unmute themselves and ask a question. We're coming on our 10 o'clock hour. Victoria must leave us, but some of her team will stay.
There's a hand raised.
Go ahead. Whose hand is up?
Niraj.
Yes, I do have a question.
Go ahead.
Like in a dining, you said you have to have a 6 feet distance. When you go to the customer to get an order, how do we take the order? Second thing, how do we serve the food? And my important thing is that another question about the employee checklist. See, my employees goes out in the afternoon and they come back in the evening. Do I have to do again or no?
So Victoria, the question was about I'll start with the last question first. The frequency of the screening. Raj, your question, it must be done at the beginning of every shift, but not every time they come back into the building. Were you asking, do they need to be screened every time they return?
Yes.
Victoria, just once a day when they start their shift.
Or if they work 2 shifts that day. Like maybe they might work a morning and then come back for supper.
And you want them screened at the beginning of every shift,
Every
not
shift.
every time they run out to deliver something and come back.
Right.
Okay?
Okay,
And
now do they have to sign that checklist every time we ask them a question?
Right. Somebody needs to signify it. Like, I don't see a problem with the person in charge being the person that says, yeah, I screened all these people. But if you capture some sort of like an initial or something like that, you're going to be much better off that somebody screened themselves.
Okay. The second question is about serving the food.
You have a face mask on and you're not going to stand there for longer than 10 minutes.
Okay, so I can go and get the orders and
Yes,
we
sir.
can go and serve them the food.
Yes.
Okay, thank you.
The chamber had a conversation on touchless pay systems. There's a video on our website if you want to read. What we learned is that many of if your swiping device is less than 6 years old, it has touchless capacity. You may have just never turned it on. We are hearing feedback from customers. The entire experience was great, and then they had to sign a receipt and were handed a pen, or there was a credit card back and forth, and they were like, oh, this was great until the end. And then you made me take your pen, and then you made me sign this document.
Okay,
So,
I don't know where they came from, but there is no less than 10,000 pens in our office. I don't know where they came from. Let us know if you need pens. My former husband was a paramedic, and he referred to these as throwaway pens. He never used the same pen like twice. He never like brought it home from work. Hey, I know that's terrible for the environment and all, but look, let us know if you need pens.
and we saw some restaurants have pens that have been touched and pens that have never been touched, and they have 2 different buckets, and they sanitize the ones that have been touched. Let me roll through a few more questions while Victoria's still here. She has a hard stop, 1 minute. Actually, do you want to just, any final comments before
What I'm going to do is I'm going to join the other meeting with my phone and just be on both. No, I really don't have any other. This was a lot of information. I just wanted to let everybody know that we do have a systemic way to gather data that is documentation that covers everybody involved in the situation, and that you understand when employees need to leave and when they can come back. If you have any of those other questions, just send me an email, or by all means talk to your environmental health specialist, because they're your first line and they're there to help you. So if you need anything else, just let us know, okay?
Excellent. Would the other members of Victoria's team identify, tell me who's on this call. Do you know, Victoria?
Angela.
All right,
Sure.
Angela, who should be our point person? Angela, are you on point with Victoria's absence? I'm going to unmute you, Angela.
I think everybody's there. Angela, Cheryl, I see Roberto, Wendy.
Good.
I'm here.
All right. Perfect. I just
Moira.
need to know who to direct.
They're all here. And then our PIO, Kristen, is here as well. And then Carla Julian is here. She is on the COVID task force for infrastructure. So she is working and listening to resources and needs issues for businesses.
Perfect. Victoria, thank you for your time. We know you have to jump. To the rest of you, we will be doing these with a frequency. We may come up with a regular cadence. We have a restaurant and hotel group, restaurant and retail, that meets every 2 weeks that the chamber hosts. If you're not on that, drop your email into the chat. We'll make sure that we invite you. Those are great conversations. But we will try to give you 3 days notice, at least, if we're going to call one of these big ones, to have a conversation. There will be other times we need to do this. There will be an outbreak, a positive, some things that make us anxious, that we will be convening you guys again. So thank you, Victoria. Let me ask this question. Someone said if a customer or client tests positive and they have been in their restaurant, should the restaurant report it for contact tracing purposes? My guess is if they tested positive, then the health department has already been alerted and that the contact tracing has begun. Is that true, Angela? Or does
Yes.
the restaurant need to report it to anybody?
No, they would already be doing contact tracing based on a positive test.
Okay, so you as a restaurant do not need to report if you've learned one of your customers was positive and in your place. That's the not required. You may want to call the health department and ask some questions and follow the protocol that was just shared with you. Let's see. There's a great note about IndyCare in Hillsborough is both doing COVID as well as antibody testing. If you want to use them. We know that the rapid antibody tests, and we can have a later conversation about what that is and how that works. Those are $40. If you go in for a regular doctor's visit, if the only purpose of going to IndyCare is for the antibody test, then they are $60. But you find out same day. They're a 10-minute test. I'm just sorry, guys. I'm scrolling through your questions. While I'm scrolling, just unmute yourself and holler out loud. It is 10. We told you it was an hour. We know some of you will need to fall off, but let's go another maybe 15, 20 minutes and get some questions answered. Who else? You can actually raise your hand like this, or you can push the little button to raise your hand, or you can simply unmute and ask.
Hey, this is Monica over at Misdemeanor. Can you hear me?
Go ahead, Monica.
So I just was curious, and people can put this in the chat, not necessarily here, but we are seeing a really, a response from our patrons that they are, that there's very low, what's the word I'm looking for? There seems to be a really low interest in security measures. Like, I think as a business, we really over prepared and we've been doing a lot of things to, kind of make people feel safe and make sure that we're protecting our employees and our patrons. But the people that are coming seem, some of them almost seem irritated by it, or they feel it's unnecessary. And I'm just wondering if other business owners are seeing this. I think the first wave of people coming out might have just naturally been the people that have always kind of had a low level of concern for transmission. And the more cautious people are the ones that are going to appreciate these measures more. Like I said, people can throw their comments in the chat, but I just wanted to kind of say that's what we're seeing from people coming out is they really are just not seeming very concerned about transmission.
Monica, I think you're onto something with who self-selected to come out to eat on the very first day or second day or third day. We're by definition people who may have thought this whole thing ridiculous. So maybe you're getting that initial. I think that's smart to think. I want to tell you, we are hearing, I saw the mayor in Chapel Hill, using a hashtag safer in Chapel Hill, hashtag safer in Chapel Hill. I think as we develop a reputation for being safer, that people will choose us. I was talking to someone in Gibsonville. They buy their groceries in Chapel Hill. They drive 35 minutes because they know it's safer in Chapel Hill. We have folks in Southern Chatham or Western, they come to have their restaurants or the grocery in Chapel Hill because they know it's safer in Chapel Hill. By that, I mean Chapel Hill, Carver, Hillsborough. That reputation, I think, will serve us well, particularly if there's rebound, particularly if there's flu. The belief that we are doing it best should be good for us. Anybody want to comment in that chat that they're starting to see some of that too? I just, go ahead. Who is wanting
I just wanted to make a comment that I work in Chapel Hill, but I live in a rural county, Vance County, and work also in Granville. And the difference that I see in how these, how Orange County, Chapel Hill, Carver area is handling this and how other counties are handling this is just amazing. I feel safer at work. I do all my grocery shopping in Chapel Hill now, just simply because you guys are doing such a great job of it. And just wanted to say thanks to everybody who's helping out with that.
I would encourage that. I think in your social media posting, The customer wants to know what you're doing, how you're being safe. They want to see you in a mask. They want to hear how often you're cleaning. And I really would encourage you as a competitive advantage to be bragging about that we're doing it safer and that you can trust us. There was a question in the chat, can somebody sue you if they think you got COVID from your business? Yes. They can sue you if they think that it was too cold. They can sue you if they thought the coffee was bad. They can sue you for any number of things. Will they win? I don't know. But as you know, they can sue you for nearly anything. What has been of concern is that your general liability and defense, some of your insurance policies have exclusions for things like this. Normally, your insurance company would pay to defend you in the coffee was too hot and spilled on my pants lawsuit, right? So be checking on that. That is worth being concerned about. But for the businesses that are doing it right, that can document that they were doing it right, your liability, I think, is a whole lot less than for the customer who came in and says, I was handed the dirty pen. They not only did they cough on me, they smoked over me. Whatever the complaint about terrible would be, you guys doing it right will be a shield. But yes, there's a great deal of anxiety, and I'm sorry that can't be clearer. Anybody else want to comment on that or having talked to their insurance? Similar experience, right, for they think they got hepatitis from you, right? Or they think that they got E. coli or Ebola or whatever they might have gotten from you. Let's see, other questions. We've got a few of your emails so that we can add you to the regular chat. Regarding touchless fees, the expert that we had on swiping and touchless systems, the fee is the same. The fee whether they tap it, the fee whether they Venmoed it to you, the fee whether they swiped and signed. We were told, and that's we have a company called Infintech that the chamber uses, some of you all use. They do about $25 million worth of local chamber members transactions for their company. And I thought for many that the signed versus unsigned receipt have the same processing fees. If you are unhappy with how you're being done by your credit card processor, we're happy to help you connect to somebody who is not going to gouge you for not physically touching the card. There are other resources out there, and the other resources, you keep your POS, you keep your equipment. It's just that intermediate processor. Some of you have asked about PPE. We know that your food service providers are offering to sell you it. The prices are pretty extraordinary. The delivery time is slow and minimum orders of $500. The chamber launched last week on Wednesday a website called Chamber PPE. I'm typing it in. I'm going to show it to you. .com. If this is helpful or you want to use it to negotiate pricing with your own vendor, let me just share it real quick. So we use the power of 1,000 small businesses and a network of chambers across the region to negotiate pricing. All of these chambers are involved. Durham, Cary, the Triangle, Raleigh's likely to come on. But the upshot is everything that's on here is in stock. You're not going to make an order, pay for it, then find out that it's 2 weeks away. Everything ships same day or next day, arrives within 3 to 5 days. If you need it overnight, you can do it overnight. And y'all, the masks are between 45 cents and 65 cents a piece. 45 to 65 cents a piece. We know that you're being charged $1, $1.50 for some of these. Sanitizer, we know you can get locally from Top of the Hill and other places, but that is here as well at less than $40 a gallon. And then the KN95s are $2.50 to $3.50 a piece, depending on how many you order. I like these little plastic doodads that attach in the back so it doesn't pull on your ears all day. They become painful. This attaches behind your neck. It doesn't, so your mask doesn't go over your ears at all. Just sort of comes around and uses this to attach. Those are 50 cents a piece. I just wanted to share there are options. This, again, chamberppe.com. And if you have things you need that you'd like to have us cover, if you use a code, Chapel Hill Chamber, with all the proper spacing, like you'd write it, Chapel Hill Chamber, they'll take 10% off of this pricing as well. So it's some of the best that we've seen anywhere. What other questions are on people's minds? Just unmute yourself and ask. So there's a question about homelessness in this crisis. It has been a real challenge. Our government has been working to, one, get the gentleman out of the men's shelter. That congregant living situation is a hotbed for outbreak, as we've seen across the country. We have a local hotelier who is offered to house the folks in our IFC men's shelter. With respect to people wandering the street, I know that there have been intervention efforts to try to make sure that people are being tested and cared for properly. Angela, will you answer questions about how frequently employees should change their masks? Do we have information on that? Anybody in the health department?
Yeah, I mean, if they get soiled, obviously you want to change them immediately. And then, of course, if people wearing cloth face coverings, that's something they should be washed, after every shift. Typically, people are wearing their mask throughout one shift. And if you're coming in for a next shift, I would say that you'd probably want to don another mask. And going back to the question about the homeless, we've got somebody on here, Cheryl, that has been involved in some of the meetings regarding some things that they're doing.
And you're welcome to chime in on that. The soiled nature is confusing because in the kitchen, they have sweat through it, right? At the first 20 minutes. Does that count as soiled to need to be changed?
Not necessarily, I don't think so. Because I know you're going to sweat through, periods. I know I do too. I carry several with me and I wash them and then I'll change them out just, to be comfortable.